The subtle signs of colon cancer. You should never ignore colon cancer, also known as colorectal cancer, is one of the most common types of cancer globally, and its rates have been rising steadily, especially among younger adults. Despite its prevalence, many people are unaware of its early, often subtle signs, because early detection is key to effective treatment and increased survival rates. It's absolutely essential to recognize the warning signs no matter how minor they may seem. Most cases of colon cancer begin as small, non-cancerous clumps of cells called polyps that form on the inside of the colon. Over time, some of these polyps can become cancerous. In the early stages, colon cancer may not cause any noticeable symptoms. That's what makes it so dangerous. You could have polyps or even early-stage cancer developing in your colon without feeling any pain or seeing any red flags. But as the disease progresses, your body may begin to whisper subtle clues that should never be ignored. One of the most common, yet overlooked early signs of colon cancer is a change in bowel habits. While occasional constipation or diarrhea is usually harmless, a persistent alteration in your bowel routine may signal something more serious. If you find yourself going to the bathroom more or less frequently than usual, or if your stool becomes unusually narrow or has a different consistency for more than a few weeks, don't chalk it up to diet or stress. Speak to a healthcare provider. Another important warning sign is rectal bleeding or blood in the stool. Many people mistake this symptom for hemorrhoids, especially when the blood is bright red. While hemorrhoids can cause rectal bleeding, so can colon cancer. Dark tarry stools may indicate bleeding further up in the colon, which is often more dangerous. If you notice blood of any kind in your stool or on your toilet paper, even just once, you should get it evaluated promptly. It could be your colon's way of asking for help. Abdominal discomfort is another signal that can easily be brushed off. Cramping, bloating, or a sense of fullness, even after a light meal, might be signs that a tumor is developing in your colon. As the tumor grows, it can partially block the colon, leading to pain or changes in bowel function. Don't ignore ongoing discomfort or assume it's just indigestion, gas, or a stomach bug. If abdominal pain becomes frequent or persistent, especially if it's new to you, it needs attention. Unexplained weight loss can also be a telltale sign of colon cancer. If you're losing weight without dieting or increasing your physical activity, that's a red flag. Cancer cells can consume a significant amount of your body's energy, and the immune system may also work overtime to combat the disease, leading to weight loss. If pounds are dropping and you don't know why, your body may be fighting something serious. Fatigue is another commonly ignored symptom. We all feel tired from time to time, but cancer-related fatigue is different. It's often described as a deep, persistent exhaustion that doesn't improve with rest. If you feeling more tired than usual for no apparent reason and find it hard to go about your daily activities, it's worth investigating. Anemia caused by slow blood loss in the colon can also lead to fatigue, dizziness, or shortness of breath, more clues pointing to the possibility of colon cancer. Another subtle but serious symptom is the feeling that your bowel doesn't completely empty. After using the bathroom, if you consistently feel like there is something left behind or like you haven't fully evacuated, it could be due to a tumor obstructing part of your colon. This sensation, called tinnitus, is not just uncomfortable, can be an early indicator of a growing problem in the lower digestive tract. It's important not to ignore any persistent gastrointestinal symptoms that deviate from your normal pattern. Even symptoms like gas, nausea, or a reduced appetite, when experienced over a long period of time, may be signs that something's wrong. Colon cancer doesn't always present dramatically. Sometimes, it quietly chips away at your well-being, slowly changing your body's habits and energy levels. Risk factors for colon cancer include age, particularly being over 50, though younger people are increasingly at risk. A family history of colon cancer or polyps, a personal history of inflammatory bowel disease like Crohn's disease or ulcerative colitis, a diet high in red or processed meats, a sedentary lifestyle, obesity, smoking, and heavy alcohol use can all increase your chances of developing this disease. However, even people with no risk factors can develop colon cancer, which is why being attentive to symptoms is so critical. For individuals with a family history or other risk factors, early and regular screening is essential. Colonoscopy remains the gold standard for detecting colon cancer. It allows doctors to view the inside of your colon and remove polyps before they can turn into cancer. There are also non-invasive options like stool tests that can detect hidden blood or DNA changes linked to cancer. Regardless of the method, the goal is the same: early detection. When colon cancer is caught in its earliest stages, the 5-year survival rate is around 90%. That's a powerful reason to listen to your body's whispers before they become screams. Unfortunately, many people delay seeing a doctor due to embarrassment, fear, or the hope that symptoms will just go away. But silence can be deadly. Colon cancer is often called a silent killer because it can progress quietly until it is too late. Don't let embarrassment be the reason you ignore blood in your stool or persistent changes in your digestion. Taking action could save your life. In recent years, awareness campaigns have helped bring attention to colon cancer, particularly through the stories of public figures who have battled the disease. The death of actor Chadwick Boseman at age 43 from stage 4 colon cancer shocked the world and spotlighted how this illness is increasingly affecting younger people. His case reminds us that colon cancer doesn't just affect the elderly, it can strike anyone, and often when they least expect it. That's why it's critical for people of all ages to know the signs and advocate for themselves in healthcare settings. If your doctor dismisses your symptoms, seek a second opinion. No one knows your body better than you do. Early detection doesn't just improve survival rates, it also makes treatment less invasive. When caught early, colon cancer may be treated with a simple surgery to remove localized polyps or cancerous tissue. In later stages, treatment becomes more complex, often requiring chemotherapy, radiation, or extensive surgery. The earlier you act, the more options you'll have, and the better your prognosis. Besides staying alert to symptoms, adopting a healthy lifestyle can reduce your risk of colon cancer. Eating a high-fiber diet rich in fruits, vegetables, whole grains, and legumes helps promote regular bowel movements and maintain colon health. Reducing intake of red and processed meats, limiting alcohol, quitting smoking, staying physically active, and maintaining a healthy weight are all powerful steps in cancer prevention. Regular screenings should begin at age 45 for those at average risk, and even earlier for those with a family history or other risk factors. Don't wait until symptoms appear by then. The disease may have already advanced. Talk to your doctor about when and how often you should be screened. Many people fear colonoscopies or misunderstand how they work, but the discomfort is minimal compared to the risk of untreated cancer. Preparation for the procedure has improved over the years, and sedation ensures you won't feel pain during the exam. It's a small investment in time for potentially life-saving information. It's also worth noting that women sometimes ignore colon cancer symptoms because they resemble symptoms of gynecological issues or are masked by menstrual changes. Women should be equally vigilant about changes in bowel habits, unexplained weight loss, or fatigue. Colon cancer doesn't discriminate, it affects all genders, ethnicities, and ages. If you have multiple symptoms at once, say, a change in bowel habits, plus fatigue and unexplained weight loss, the urgency for evaluation becomes even greater. While one symptom alone may not mean cancer, the combination of several symptoms could be your body trying to tell you something very important. It's not about creating panic or assuming the worst. It's about being proactive with your health. Prevention is always better than cure. Taking steps today to eat well, exercise, and get screened can make all the difference in the years to come. Colon cancer doesn't have to be a death sentence. With education, vigilance, and early action, it is one of the most preventable and treatable forms of cancer. But the key lies in listening closely to your body and taking subtle signs seriously. Never assume it's just stress, just gas, or just aging. These small shifts may be the very whispers that save your life. In a world where we're constantly bombarded with information and distractions, it's easy to overlook the quiet messages our bodies send us. But when it comes to something as serious as colon cancer, ignoring those signals can be deadly. So, the next time you notice something unusual, no matter how minor, don't dismiss it. Trust your instincts, prioritize your health, and speak with a medical professional. Because catching colon cancer early isn't just about surviving, it's about thriving, living fully, and being here for the people who love and depend on you. Don't let the silent killer sneak up on you. Stay informed, stay alert, and stay alive. Thank you for watching and taking the time to prioritize your health. Colon cancer may be silent at first, but with awareness, vigilance, and early action, we can change the outcome. If this video helped you better understand the subtle signs of colon cancer, please share it with others. You never know who might need to hear this information today. And if you haven't already, make sure to subscribe to our channel for more life-saving health insights, tips, and in-depth wellness content. Your health is your greatest asset. Protect it, listen to your body, and stay informed. We'll see you in the next video.